Hello, I'm Brian Prescott with PCCA. I'm here with Dr. Brian Futrell, wound specialist. And I'd like to talk a little bit about arterial ulcers.
In arterial wound, we have an occlusive process, limited blood flow to the tissue. In that situation, there's no brick and mortar, right? We don't have oxygenation, we don't have collagenation, we don't have anything attributing to the wound environment.
And what I've noticed on a lot of these wounds is when we see an arterial wound, you can obviously see there's a lack of circulation there. We'll take pulse pressures, you'll get a pallor when you lift the feet and whatnot.
Yep.
So whenever I'm treating an arterial ulcer, my thought process is, hey, let's see, well, first of all, is there some kind of surgical intervention that can be done? And in the meantime, maybe we can stimulate some circulation in the meantime, before or after the surgery, maintain the antibacterial, make sure that we have no infection.
We really need to manage that wound from its vascular component, right? We need to partner with the vascular surgeon, where myself as a wound specialist, I'm not going to actually perform the vascular intervention, but I definitely recognize the importance of that. But on my side of the responsibility, I need to maintain that wound environment, protect it from infection, right? And coordinate that therapy with the vascular surgeon.
So when you say you're maintaining that wound, what does that mean? Does that mean we're not needing to stimulate that wound bed? Because I have a lot of people that call me in and say, hey, I like your formulas with the misoprostol, the phenytoin to stimulate growth. So what you're saying on those arterial situations is we may not need to stimulate growth if we take care of the factor that's leading to that condition.
Well, correct, but let's say this, it's not a primary factor, right? It's not that we simply throw away the idea that maybe we could get some benefit from stimulating the wound, but it's certainly not going to be our primary responsibility. Our primary responsibility is maintaining the wound environment from infection so that once the vascular surgeon does their job, we don't have a loss of tissue making our job more difficult, or even, God forbid, a loss of limb in that patient, which can be debilitating and even life-limiting.
Well, thank you very much for your time, Dr. Futrell. I've learned a lot about arterial ulcers. I hope our audience has as well. Do you have any takeaway points for them?
Well, ultimately with arterial wounds, it's the requirement to recognize the wound appropriately and get it into the right hands, or in my sense, a referral to vascular surgery, endovascular, cardiology, radiology. But the idea is arterial wounds aren't going to heal if that circulation isn't improved.